Hi guys, so this is the overview of delirium. What is delirium? So the medical definition of delirium is an abrupt change in the brain that causes mental confusion and emotional disruption. There's a breakdown in communication between synapses and neurotransmitters, so the brain isn't getting appropriate messages. Francis describes delirium as a medical emergency, which requires immediate diagnosis and treatment. Oftentimes it is misdiagnosed or the diagnosis is missed, and that it's important to diagnose it and treat it immediately because according to Francis, either the patient will get better, which most of them do, or they can suffer permanent brain damage or die because of the effects of the delirium or the medical condition causing delirium. A couple of facts about delirium. Usually occurs in hospital settings, primarily in nursing homes. It is more common amongst the elderly population. So usually people who are older are more prone to delirium, hence the hospitalization in nursing homes. And it's very low amongst general population. So if you look at the population as a whole, you wouldn't see a lot of cases of delirium. But if you look more so in the hospital settings, emergency rooms, nursing homes, that's when you would start to see the cases kind of increase. What delirium looks like and the criteria. So the onset, it happens very quickly. It's a change in attention, awareness, and cognition. So there are severe deficits in attention. Clients who have delirium, they wouldn't be able to hold attention. They would be easily distracted, confused. Their awareness, they wouldn't be able to orient as well as somebody without delirium, and cognition would be impaired. Also, they would tend to be highly emotional. The symptoms often tend to get worse at night, although they can fluctuate from minute to minute, day to day, depending on the severity of the delirium and the cause, or at times when there aren't as many context clues, environmental cues as to what is going on. So the criteria based on the DSM-5 for delirium, disturbance in attention. So as we talked about, they wouldn't be able to hold attention. It's, the reduced ability to focus. You can't really sustain. They wouldn't be able to shift from person to person in multiple conversations. Wouldn't be able to repeat back flashcards, etc. It develops over a short period of time, so usually hours to a couple of days. So it happens very, very quickly. And it usually gets worse throughout the day. A disturbance in cognition, so that's the memory deficit, disorientation, sometimes it's language, sometimes it's perception. As somebody with delirium might not be able to tell you, what day or time it is, wouldn't be able to tell you where they're at, etc. They wouldn't be able to orient themselves. Probably wouldn't be able to remember conversations, that had just happened. They would be very, very confused. Disturbances in ANC, so the attention and cognition are not better explained by another neurocognitive disorder. It also means that they cannot be in a coma. So if a person is in a coma, obviously they're going to have a disturbance in attention or cognition, but that wouldn't count as delirium. Delirium can cause comas if left untreated, but coma is not a criteria for delirium. And there's evidence that the disturbance is a direct psychological consequence of a medical condition, substance abuse, or withdrawal. So unlike others, this is one where substance abuse or withdrawal would not necessarily mean a different diagnosis. Additional signs are disruption in the sleep-wake cycle. Even though they're not criteria, most people with delirium have very, very difficult time falling asleep, staying asleep. Maybe they can't sleep at night. They can't orient to know when to sleep. That's a huge side effect for delirium. And there's a lot of emotional disturbance. mood swings, sometimes some anger, some outbursts. You think if you can't orient, if, you have other things going on, you tend to get a little emotional. Risk factors include repeated falls. So somebody like the elderly who fall down a lot, that would increase the risk for delirium. Low activity, so not somebody who's necessarily a couch potato, but somebody who may be stuck in a wheelchair, who isn't able to get up and participate in activities. Substance abuse, medicine prescriptions, so certain psychotropic medications can cause delirium. Age, it is mostly prevalent in the elderly. Major and mild neurocognitive disorders, they can also increase the risk for delirium and increased hospitalization. Okay, so there's different types of diagnosis for delirium. There's substance intoxication delirium. So this would be that, if you had the disturbance in cognition, disturbance in attention, and also the same criteria for substance abuse, then you would diagnose with substance abuse delirium, and you would identify which substance the intoxication was causing the delirium. So it would be marijuana or heroin. And you would also specify whether or not it was mild with disorder, moderate or severe with disorder, or without disorder. So that would all be in the diagnosis. Same thing with substance withdrawal. If the criteria for A and C are present, then you would diagnose with substance withdrawal, naming, of course, the substance. Medication-induced delirium. Certain medications can cause delirium. If that person is ingesting that medication and you have the medicational history and A and C are present, you would identify the medication that was causing it with the delirium. Delirium due to another medical condition, and delirium due to multiple etiologies. So multiple etiologies, it could be that they have a medical condition such as HIV and they have substance abuse. So it's very important to diagnose appropriately under the specific criteria. And to keep in mind when you're diagnosing, you want to specify whether it is acute or persistent. In other words, if it is lasting, just a couple of hours, couple of days versus longer, whether it's lasting, a week or so. And then there's hyperactive versus hypoactive and mixed level of activity. And they have a level of psychomotor activity. Maybe they're refusing to cooperate, they're very twitchy, very hyperactive versus hypoactive, which means that they can't really get their motor or their psychomotor activity. So gross and fine motor skills are not working as appropriately. They're not speaking in a tone or a rate that's appropriately. They're not responding that quickly. So that would be more hypoactive, or they can have a mix of both. And it's important to specify either or.